And then as far as the total knees, what kind of surgery are you doing now? Like I've heard there's lots of new stuff out, like robotics and.
Yeah, so I've gone through the certification for robotics. Where I currently operate, we don't have a robot. They're looking into potentially getting one. They are doing a robot, and the robot is designed basically for cuts, making basically your femur cut, your tibia cut, and so you basically dial it into you basically use a preoperative CT scan where they get a big scan of your knee, and you basically open the knee, and you basically match off those points with a little device they have, a little tracker, and you touch all these different spots in the knee that make it correspond to the preoperative CT scan, and then they put that into this robot, and then the robot says, okay, well, these are the, you kind of decide where you want to make your cuts, and then plug it into the robot, and you just kind of guide the robot in there, and it makes the cuts. There's advantages of the robot, or that it is probably potentially less damaging to the soft tissues. And it does add time to the case. So there's more open skin time in most cases. Certainly a learning curve, and so that's kind of like the experience of people who've kind of been using it. We have not used it much at St. Tammany yet. I know they are using it in town. That's kind of a newer thing. Robots in shoulder surgery, to kind of switch back to talking about shoulder surgery, are kind of maybe a few years down the road. Not quite as sure how they're going to apply it yet. The thought is maybe on the preparation of the socket when you're doing total shoulders, but they haven't really figured that out yet. It's definitely a much smaller space to work in the shoulder than it is in somebody's open knee. So I think that some of the thought is that the robot could be a little large and cumbersome as well, because it is kind of a big device. There's not enough data yet to say whether one is better than the other. For years there has been what we call navigation for knee replacements, and that's done through a similar mechanism, but not quite having the robot make the cuts. It's just that you kind of put little markers on the knee, and you basically dial in your cuts based off of that. And that hasn't really been borne out to show any difference in outcomes necessarily in patients. So it kind of has lost favor a little bit. So the robot, although seems like a potentially more promising endeavor, we just don't really have enough data to say it's much better yet.
Got it.
Yeah.
Cool. Well, thank you so much for your time. Is there anything that I missed that makes you such an excellent orthopedic surgein over somebody else? I know you've had a lot of training and stuff in the shoulders.
Yeah, I mean, I think the unique thing, I think the only, there's a lot of great orthopedists around here. We're fortunate to be in an area where I don't want to say overly saturated, but we're somewhat saturated, and that we have a lot of people to offer care. I would just say, the only unique thing that I would say is that, my shoulder fellowship is something that I look at as a unique component to my training. There's a lot of fellowships that do some shoulder replacements here and there, but the shoulder fellowship was basically just, almost all we did was just replacements. And it was very heavy in that. And I trained with some great mentors who are very well known around the world. And they just, really kind of, I learned more. I still say this to this day. I learned more in probably the first one day in the operating room with one of those guys than I learned in my entire year doing shoulder replacements as a sports fellow. Not because they didn't do a good job there. It just was a different mentality, different mindset.
Right.
So there's definitely a difference from, I do shoulder replacements versus kind of like, but I do a bunch of other stuff versus the guys who do it all the time. And so I learned a lot from those guys. So that part I feel like makes my practice a little bit unique, and my experience, I'd say more than anything, a little bit unique. But otherwise, no, I think there's a lot of great people out there who all do a very good job.
Awesome. So yeah, I think each of you probably specialize in your own thing, and that's kind of what we always look for. Is I want somebody that knows what they're doing for the shoulder, right. And I want somebody, for each different body part. So
yeah, and that's the way medicine is kind of shaping. The days of there's a few good guys out there, still very good generalists who can do just about everything. But the way medicine is changing, the way training is changing, everything is kind of shifting towards a specialty focus within a specialty. So it's it may seem like, well, wouldn't you want to be able to do it all? Yeah, but the people who do the most of everything tend to do it better. So I would say that that's kind of that's kind of the way we're shifting. And the end goal is for better patient care. So.
Got it. And one last thing while I'm thinking about it, shoulders, do you do elbows, hands too, or mainly?
I do. So I do, I see hand up to neck, or I'm sorry, I see hand up to shoulder. I see a lot of neck pain because a lot of people confuse it with shoulder pain, but that's okay. I try to get them to the right people. But I do see hands. I would tell you, if it's complex hand stuff, I do try to get them to a hand surgeon. You know, we'll occasionally see some carpal tunnels and things like that we take care of. I do see elbow complaints as well. I did do some elbow training in my shoulder fellowship with shoulder elbow, but for about 95 shoulders, you see about 5 elbows are just so much less common. But I see everything from fractures and everything up to the shoulder. So I do treat most of that stuff as well. Again, if there is any thing that I feel like is out of my realm, there is some pretty good overlap with the hand guys, because a lot of the hand guys do hand to elbow, and you know, I kind of do shoulder down to elbow, so we kind of overlap well and can find a nice complement. Because like I said, we do have some people around who are well trained as well. So
awesome. So if somebody wants to schedule an appointment with you, what number do they call?
So our office number is 985-893-9922. That's to get to the front desk. However, if they're ever somebody that you know, or you want to reach out to me, I can always, circumvent that and kind of, take care of it myself. So
is there typically a long waiting period to get in to see you?
Not traditionally, not super long. Usually we get patients in with about a week or two at the latest. Sometimes I get them in the next day. It just depends on the day. Things, sometimes there's open spots. We go by a template, and there's, established patient visits and new patients, but we can tweak that sometimes as well. So it's usually not an issue. But yeah, we can get patients in pretty quickly.
Perfect.
So it should never be hopefully never an access issue.
Awesome. All right. Well, thank you so much, Dr. Lamartina, for being with us. And y'all feel free to contact him with any questions. Go see him for your shoulders and your knees, and he'll take good care of you.
All right. Thank you.